Hi, my name is Allison Kane. I attend the Research College of Nursing, and I am pursuing my master's degree in executive practice and healthcare leadership. This is my book summary for Nurse Executive Health Systems. I read The Healing of America, A Global Quest for Better, Cheaper, and Fairer Healthcare by T.R. Reid. About the author. Mr. Thomas Roy Reid III was born in 1944 in Baltimore, Maryland. His education: he was a classics major at Princeton University. He also studied law at Washington University. Later, he served as a naval officer and eventually taught at Princeton and the University of Michigan. Mr. Reid is a national public radio commentator and frequent guest on the National Public Radio Morning Edition. He's the author of several books: The United States of Europe, The Chip, and Confucius Lives Next Door. His next book on taxes around the world will be published April 15, 2017. The Healing of America, A Global Quest for Better, Cheaper, and Fairer Healthcare. The title itself describes specifically what Mr. Reid intended for this book to convey. The major theme of the book is contrasting healthcare in the United States with healthcare in other countries. The book is broken down into chapters. In the prologue, we meet Nikki White, and Mr. Reid raises a moral question. He describes a young lady forced to face a serious disease, systemic lupus erythematosus, and her difficult journey without healthcare coverage. Nikki was a college graduate that made too much money to qualify for welfare. She did not have enough money to pay for the drugs and doctor's care needed to stay alive. Sadly, Nikki died at 32 years of age of a preventable disease, treatable if she would have had health care coverage. Two valuable contributions to the discussion of healthcare issues in America. First, Mr. Reid encourages leaders to answer this most basic question: can society allow a person to die because they do not have the funds to purchase health insurance? Mr. Reid provides short summaries of major forms of healthcare systems: the Bismarck model, the Beveridge model, the National Health Insurance model, and the out-of-pocket model. The Bismarck model, found in Germany, Japan, France, Belgium, and Switzerland, provide health insurance plans usually financed jointly by employers and employees through payroll deduction. The unemployed, or those unable to no longer work, have these insurance premiums paid by the government. The Bismarck model plan covers everyone. They do not have to make a profit. The government plays a central role in determining payments for various health services and therefore has a tight regulation of these healthcare services. The Beveridge model, found in Great Britain, Italy, Spain, and most of Scandinavia. It's the closest to socialized medicine. Healthcare is provided and financed by the government through tax payments. There are no medical bills. The government acts as a single payer for all healthcare services. Medical treatment is considered a public service, like the fire or police services. Many but not all hospitals and clinics are owned by the government, and most all doctors are employed by the government. Cost is controlled because the government acts as a single payer and controls what the doctors can do and what they can charge. The National Health Insurance model in Canada, South Korea, and Taiwan combines elements of the Bismarck and Beveridge models. The providers of healthcare are private, but the payer is government-run that everyone pays into. The National Health Insurance model, the insurance plans collect monthly premiums and pay the medical bills. The biggest drawback is a long wait time for procedures. For example, Mr. Reid would have had to wait 18 months for his shoulder treatment if he was in Canada. The out-of-pocket model, countries are too poor to provide national health service. For example, India. The rich get medical care and the poor stay sick or die. There is no public-wide service health insurance. Most all countries with such a system have lower life expectancy and high infant mortality rate. Mr. Reid set out on a global tour of hospitals, offices, health ministries to see how other industrialized democracies organize healthcare systems that are universal, affordable, and effective. Reid points out that the design of any healthcare system involves political, economic, and medical decisions. The primary issue for any healthcare is a moral one. Reid suggests if America wants to fix their healthcare, they first should answer a basic but very tough question. Should we guarantee medical treatment to everyone who needs it? Or should we let Americans like Nikki White die from a lack of access to healthcare? We should draw valuable lessons from each of the models. Mr. Reid, and I quote, "If Americans can find the political will to provide healthcare for everybody, the rest of the world can show us the way." Mr. Reid focused on 4 big countries with similar political and educational structures like America, the free market democracies that have embraced high technology. Mr. Reid used his shoulder injury that he received as a naval seaman in 1972 as another focus subject for his search. The American physician recommended to Mr. Reid a total shoulder arthroplasty. 2 basic flaws Mr. Reid identified. Number 1, most national healthcare systems are not socialized, but they provide universal healthcare of high quality at a reasonable cost. And number 2, our VA and Medicare system are both socialized healthcare systems. Why does the U.S. spend more on healthcare? The providers, doctors, nurses, hospitals, drug companies, all make more money for what they do. Prescriptions cost 2 times more. Physician educations, they can end up with $100,000 in loans compared to a free education in other countries. And lawsuits. Malpractice lawsuits are very high in the United States. The Vital Card is a variation of the Bismarck model. It's not socialized medicine, the system of private doctors treating people. People buy health insurance from government health plan and from private insurers to cover most of the cost. The French insure through their jobs. The employers split the cost. In Germany guarantees medical care to 82 million Germans and to millions of guest workers, whether they're legal or not, who live in the country. The package of benefits is generous. It covers all types of health care. The downside, the free choice of insurance costs money. It's one of the most expensive healthcare systems. They strictly control payments to providers. In Japan, Mr. Reid witnessed everything from acupuncture to injections, manipulations to his shoulder, and then they even suggested the total arthroplasty. But he would have had no waiting. There is no gatekeeper, no rationing. The prices are low. There's rigid cost control that favors the patient. The Japanese people go see the doctor 3 times as much as the U.S. They make house calls. They provide health care to every person. It's nonprofit, but there is no choice in the insurance plan. In the UK is universal coverage, no bills. Nobody should ever have to pay for medical bills. No insurance premiums, no copay. The doctor bills are paid by the government. You pay for health care with high taxes. An example, in the UK, the sales tax is like 17.5%. It's the most dreaded part of it is called the queue. It's the waiting list. You could wait months, weeks to get an appointment. The out-of-pocket model is, for example, in India. They use other treatments like rocks and shells and statues. Mr. Reid had to see if the stars were aligned for him to have healing. There were prayers to the Hindu gods, meditation, herbal oils, manipulations, and massages. The rich, the military, and some other government employees get medical care. All the others either stay sick or die. The citizens in the United States have a lot of rights. Some are guaranteed by the Constitution, some provided by statute, some created and protected by courts. But the United States Constitution does not guarantee the right to health care. Reid makes this shocking statement about the wide spectrum of U.S. people and health care. Quote, "For the law-abiding, health care in the U.S. is a product, something Americans buy if they can afford it. If you are a senior, a soldier, a veteran, a Native American, a member of Congress, or if you have renal failure, or if you're scratching on the bottom of the poverty level, government will help you obtain health care. All the rest, 70% of the population, you're on your own." In the end, T.R. Reid's healthcare journey, major surgery was not indicated. Periodic steroid injections and regular physical therapy and therapeutic massages were suggested. The U.S. healthcare reform is a journey. Any proposal of reform continues to rely on our fragmented structure of overlapping and often conflicting payment systems. American exceptionalism was brought up. This is the notion that the United States has nothing to learn from the rest of the world. But we do. Some elements are working well. The training of our physicians, nurses, and we have state-of-the-art medical research. Mr. Reid also talks about the Patient Protection and Affordable Care Act and Obamacare. Should we extend insurance coverage to millions? The harsh truth? The U.S. will still have the most complicated, most expensive, and most inequitable health care system of any developed nation. New laws still have not led the United States to what other industrialized democracies have achieved: universal health care coverage at a reasonable cost. Thank you very much.